202-0215. Rev-Up St. Lucia, the alpha of radio.
Doctor in the House with Dr. Leonard Surage, brought to you with the compliments of La Place Salazar, Ultramart, the Labrie Cooperative Credit Union, and Tapio Hospital.
At Tapio Hospital, caring and competent obstetric consultants will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapio Hospital, where the patient's safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time, a time when your plans and dreams fall into place, when what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Place Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazar, of course. La Place Salazar, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, hosted by Dr. Leonard Surage. Dr. Surage, a very good evening to you.
Good evening, Andre. Good evening, listeners. Good evening, viewers. And welcome to Doctor in the House. Today, Tuesday, 29th of July. And today a bit rainy, but I hope it clears up in not too long from now. I have with me in studio Dr. Gilad, who is a psychiatrist. If you may remember, about 2 weeks ago, he was here with me and we had an extensive chat and discussion on early childhood development. And we spoke about how the environment and the upbringing can influence their behavior, their personality, and not their entire personality, but it can shape up what they become as adults. So we are here to build on this particular phase and talk about psychiatric problems, psychiatric illnesses, and some of which may have been derived from predictable sources like the early childhood. Others may be genetic and so forth. The expert will tell me more about it, so I will waste no time to reintroduce Dr. Gilad.
Thank you, Dr.
Thank you
Suraj.
for being here with me.
Yes, Andre, nice to be here.
Welcome once again, Dr. Gilad. Good to have you.
Same here.
Yeah, so tell me about the psychiatric illnesses, the mental illnesses you generally encounter in our St. Lucian setting.
Well, before I just move on to the specific illnesses, I want to clarify the difference between mental health and mental illness. So mental health is basically your overall psychological and emotional well-being. However, mental illnesses are diagnosable conditions that affect your emotions, your behavior, your thought. Yeah? Everyone has mental health, but not everyone has mental illnesses.
Say that again, Doctor. What did you just say there? Everyone has
mental health, but not everybody has a mental illness.
Okay.
Right.
Yeah.
And illness is a condition that you have, right?
Yes.
Right.
So how we can think about it? If we look at physical fitness, everyone has it, and whether they have poor fitness or good fitness, everybody has it. However, there's physical disease. So somebody might have obesity. Doesn't mean that they don't have physical fitness. It's a level of fitness.
Okay.
But when they develop things like high cholesterol and heart disease and so on, that's physical illness. Yeah. An example of mental health is feeling anxious or stressed about an exam you're going to take, or maybe your money is low and you don't know how you're going to pay the bills. That's you feeling stressed. So that means your mental health may be deteriorating. But a mental illness from that would be a period of time that you're going to be stressed, so you develop anxiety, excessive worry, and all of those things, which we may touch on a little later on.
Yeah.
And so you may need treatment for that. So you don't need treatment for your money being low and being unable to pay your bills. Maybe you need money, and that may help. But for mental illness, you may or may not need treatment, depending on the severity of it.
All right. So you mentioned something, one of my areas of interest, and that is stress. And stress and anxiety. I mean, I see so much of that, what I consider to be stressful, people who have stress condition manifesting itself in so many physical ways.
Yes.
And I'm sure that's a big part of what you see as well.
Yes, of course. We tend to underestimate the effect of stress, and persons believe stress is only negative things that are happening in life. I remember having a few clients, one of them who has bipolar disorder, and he got a promotion at work and he had a relapse. So even that can be stressful for somebody, because of the belief system that may underlie the situation. So we may see a promotion as something positive and good, but then the person may have beliefs about, I'm not good enough, am I worth that position that they're giving me, and that may be very stressful for them. But we're not aware of that. We see them smiling and saying hooray, but underneath that there's other stuff going on. So we have to be, when we're saying stress, it's not only good things happening, bad things happening.
Yeah. And from a medical and psychiatric perspective, how do you know when somebody's under stress?
Well, we cannot know that somebody is under stress.
There's no test for stress.
There's no test for stress.
So it's a behavioral thing.
We have to have a conversation with the person to ask them how do they feel about what's happening. And it's one of the things, I guess, because some doctors are very busy, or you're in a clinic and you want to see persons quickly, especially if you're in a public service, so you don't have time to have an in-depth conversation as to what is really happening. And so we may see symptoms. Yes, and I remember working at the wellness center. We didn't have much time to see persons in depth, but getting to know the underlying conditions, the way the brain works around what's happening is important.
In fact, it's a very important thing you mentioned, because I've been asked that question before. You working in the government service as well as in the private sector, how is that those in the private sector get more detailed treatment than those in the public sector? And my answer is that in the private sector, I may be seeing about 5, 7, 8 patients for a day. In the public sector, for the 4 hours I'm there from 8 to 12, I see about 30 to 40 patients.
Yes. So persons don't realize that reality. So and speaking of the 30, 40 patients, we then neglect the stress that the doctors are going through. So then you're seeing 40 persons in a short period of time. It also stresses you out, and then you have nowhere to process that stress that you just experienced, and you do that every day for a period of time. And you expect it to be perfect at what you do. So
Let me give you an example that always concerns me, and it is part of the stress issue. I have known many people who go to England in the early 60s, spend about 30, 40 years there. They would have want to they're coming back in their 60s, 65s, etc., and or maybe 70, and want to relocate home, having the perception that home is the home they left, even though they visit, but living in a country and visiting to different things, you interact with people. So they decide to build a house. So they go through the whole process, the stressful process of relocation, leaving the States, leaving England or whatever, come to St. Lucia, the Caribbean, and get into building, which is a horrendous exercise, because not knowing how the builders work and how the work ethics operate, and material and petty larceny, theft, this, that, and not doing the guys not being able to do the job the way they want it done. So after a series of stress they go through, eventually they may not live very long. You get a heart attack, they get a this, they get a that. So I've seen quite a few, I cannot tell you by numbers, but I thought I was seeing a pattern that developed with people coming in at a certain age and a certain level of stress, and things just happen to them.
Yeah, and it's not just that, Dr. Surage. I believe the change in activity levels. So a lot of persons, after they retire, their activity levels decrease significantly. And they would have been in one environment which maybe there's high stress, and that high stress over time may have caused certain things to develop in the body. That when they get here, then the activity level drops even more, and the frustrations, like you said, of moving and so on, and that may cause other complications or add to the risk that they already had when they moved over to the whatever country they were in, and it may lead to whatever consequences that you may be experiencing.
Yeah. And well, I'm looking at typical examples. For example, stress itself varies from person to person, I think. Because, for example, somebody like a president or a prime minister, man, these people are stressed. They work hard, they have a lot to think about, the whole world of their country is on their shoulder, and they manage. On the other hand, another person may have just two little things, their children fighting.
So when we're looking at stress, we have to look at another word called resilience.
Resilience,
So no two persons respond to the same event the same way. And that depends again on upbringing, the belief system that you have underlying, and a whole host of other
your
risk
upbringing
factors.
can help you cope.
Oh, definitely.
All right.
So I don't know if last time I was there we spoke about the adverse childhood experiences, and those adverse childhood experiences can be a significant risk factor to our emotional resilience, our the way we look at stressful experiences. One example, somebody may see a negative, something negative happening as a stepping stone to something greater. Another person might see it as an obstacle and a weight, and so those two persons, the way they see that event, the behavior that they exhibit is significantly different. So
you can think of one example.
Okay, so let's look at a man whose woman, he comes home and finds his woman in bed
with somebody else. All right, okay.
Yes. And one person may say, wow, at last I can be single and free and walk right back out.
Okay.
I've been waiting for something like that to happen. And another one might just not see again and wake up in prison. You understand?
That's right.
So the different ways of seeing what is happening in front of me. Or even a simpler one, somebody loses their job, and that one person might see it as an opportunity to put themselves out there, to work a little harder to get something better.
As they say,
another person might see it as the end of the world.
All right, as they say, when one door closes, another door opens.
So some person see it. So it's a glass half full and glass half empty analogy that we have to think.
And that's a function of your attitude, your bringing your level of positivity.
Yeah.
So I see. I can identify with that one.
So if we have to look at your first question, the most common mental illnesses we have in St. Lucia, I do not know of any studies apart from the WHO. I think it's called an AIM study that was done like 2010 or something like that. And I don't know of anything that's been done afterwards. But the prevalence of mental illnesses in St. Lucia does coincide with the worldwide prevalence. So there's not much difference.
Oh,
So I think the most common mental illness we have on island is anxiety. What we call generalized anxiety disorder.
Can you describe?
So it's basically a period of 6 months or more. Some persons may have a little less of excessive worry. Persons, when they think of anxiety, think of I start to freak out. That's panic.
Yeah. That's
so it's
panic.
excessive
That's
worry,
anxiety.
difficulty stopping worry. The person may become more irritable than usual. The person may become forgetful or start blanking out. The person may have difficulty sleeping, and the sleeping anxiety is different to the sleep in depression. So with anxiety, the person goes to bed, has difficulty falling asleep, has difficulty staying asleep. So they may have short periods of sleep, and then they wake up tired. They wake up feeling tired and drained, and so on. And the person has something called apprehensive expectation. So in other words, something bad is going to happen, and so I overthink everything, and I can't make decisions because I know something bad is going to happen, and that is having 4 or more of those.
But Doc, I see so many of these people.
Yes.
Yeah.
So you either treat them or you send them to a psychologist, or you send them to me.
That's right.
And that is one of the more prevalent illnesses. I think the prevalence is about 15% of the population suffer with some kind of anxiety disorder.
Are the reasons different for each person, or some similarities?
Yes, it is. I guess there are different categories of reasons. Most have to do with life events. So maybe somebody who grew up with overbearing parents who criticize them a lot and so on. And so they grew up feeling I'm not good enough, and so every little thing they have to be perfect at it, and they have to foresee everything that's happening next. I'm actually reading a very interesting book now called what's it called again? The love of questions. I tell you, let me just pull it up for you because I love to read. And it's called How to Fall in Love with Questions, and that basically deals with anxiety and how to see questions differently. So I have to know what happens next. How do we manage that? And a lot of us that's how we live. I have to know what happens next, and if I don't know what happens next, I freak out. Most of our parents, that's how they raised us. If I don't raise you like this may happen, and that's the same thing. I have to know what happens next.
Sometimes they were protective.
But I could understand that if I don't raise you properly, what will most likely happen? I can understand
properly
that.
Is relative.
Yeah, well, that is true. I can understand a parent, quote unquote, worrying about something like that, but to worry about what you have literally no control, at least with your children, you have some level of quote unquote control.
You don't actually.
You don't have a level of control?
Zero. You believe you have control, but what you're doing there is you're trying to control something that's not controllable. You may, for example, you have a child and you tell the child, don't do that, and the child does it, and you beat the child. The child complies not because they know better. The child complies because they don't want to get beaten again. Yeah.
So Dr. Gillard, sorry, I mean, I have to challenge this one there.
Go ahead.
Yeah, because in other words, then what? Just raise our hands in the air and say, well, if that's what it is, let my children do what they want?
No, it's about having conversations and being present. Remember last time I was saying that being present with yourself.
But does not mean you're trying to have a level of control of the situation?
No, you're not. You see, you're seeing it as control, but it's not about. It's about learning how to deal with the anxiety that you're feeling inside. Because what is anxiety? It's a feeling that you experience. The child is not feeling anxiety about what they're doing. The parent is the one feeling the anxiety. So how do I manage what I'm feeling inside whilst I have a conversation with this little one to let them know that I am seeing something will happen, and it very likely will happen, and to allow them to understand that I am only behaving in their best interest, and I'm not trying to control or exert control over them. Because it may happen with small children when they become teenagers and they start to become oppositional and defiant. Then the parent gets a lot more anxiety and they don't know what to do. I raised you and you're doing this, and I raised you. I tried my best, and that's the kind of things you're hearing. And yes, you tried your best. However, you were filled with anxiety and you're raising a child with anxiety. And that most of the time does not work out well.
So Doc, what I'm understanding from there is that you have to reason with the child to tell them why you take the position you take.
Yes.
And for them to understand it's for their best interest.
Yes. And before you do all of that, you have to reason with yourself to find out where that coming from. Why am I feeling this way about a child doing this? And I'm feeling so much angst inside of me. What's going on? What belief am I carrying? What belief am I carrying from my childhood maybe that makes me believe I have to control that situation? A simple thing is, for example, washing dishes in the sink. And some parents hit the roof when there's dishes in the sink. And the child have to, because I raised you and I made you and I put food on the table and blah, blah, blah. And that is basically letting the child know, hey, I love you, but with conditions. And think of it, a woman comes to you and tells you, Andre, I love you, or Dr. Surage, I love you, but with conditions. How do you feel?
But no, we don't express those, we don't say those things to anybody.
We don't, but our actions say it. And that's how the child sees it. So everybody loves me with conditions, so I start to love myself with condition. And I have to do things perfectly, and if I don't do things perfectly, then I'm a failure. And
you begin to feel negative about it.
Right, so then a lot of anxiety starts to develop, and I start to question all my decisions. And I get a promotion at work, and I wonder if I'm going to be able to manage. And so it's a whole cascade of stuff that happens after that we, in our anxiety, were not aware that we're going to cause.
So honestly, I wish we had more time to explore.
No, but it's important. In the same way the listener is following through this program, they want to understand the reasoning behind it, which is what sometimes I press for a little more basic explanation.
More clarity. Yeah. Because I'm sure, Dr. Gillard, a lot of parents are listening right now and saying, what? I mean, it's like the impression I'm getting is that if you don't, negotiate with your children.
So you're seeing it as negotiating with your children, and it's not. It's about being present with your children and for your children. So it's like the child. So let's look at a 2-year-old child. And I'm sure you remember a couple years back, there was this video circulating about this father beating hold up the child like that and beating the child. And it was like a 1 or 2-year-old little baby. I mean, what do these children know about what is right and what is wrong? Yeah, so a little baby like that, you beat them so savagely. What does the child learn?
It's more about you, the parent.
Exactly. The child then learns, this person who's supposed to love me comes at me and causes me so much pain. So if this person who loves me causes me so much pain, then I must be unlovable. Because remember, I also told you that children are narcissistic. So everything is about me. So if this person has so much anger at me, it must be my fault. I'm doing something wrong. I must be unlovable.
Dr. Gillard, I understand that completely.
Yes.
I think you're saying the mode of the discipline/correction makes a lot of difference, right? It's one thing to maybe negotiate or reason. It's another thing to be slapping and hitting. I understand that.
So say you are seeing it as negotiating and reasoning. I don't see it.
Well, you use reasoning. They use that word.
Dr. Surage used it. No?
Dr. Surage.
I don't see it as reasoning or negotiating. I see it as communicating.
Okay, so we take communicating. Okay. All right, the way we communicate.
Or having a conversation.
Yeah. But what I'm saying, Dr. Gillard, the ultimate aim is to have, I don't know how you see Dr. Surage, the ultimate aim, whether you use reasoning, whether you hit or whatever, is to have a level of control. You have to try to control the situation before it gets out of hand. I mean, to me, that's just common sense. Now you say...
So the question is, how do you know it's going to get out of hand?
Well, if you don't... you see...
How do you know that?
Okay, so you see your son...
And I like to ask all my parents, you have no idea how the child is going to turn out. I had one example of a child who was at one of the secondary schools. And the mother was in a fit, the child not studying, and a very intelligent child. And the mother wanted to keep the child back and so on. I was like, why? The child will do well. And the mother... made a fuss. Eventually she relented, and the child got all ones and all kind of story. Like, so what was all your anxiety about? Because you didn't know. And that's basically it. I don't know what's going to happen, So I become anxious.
But I mean, there's some likely signs and trends that would indicate where a particular thing is going.
No.
Because Dr. Gillard, you're saying, okay, you have an 8-year-old at your home, an 8-year-old,
Yes.
and you see this 8-year-old moving about with certain friends.
What you have to ask
and so
yourself first is, why does the 8-year-old see those friends as a safe space and not me as a parent as a safe
but that's not what we're
space?
talking about, Dr. Gillard. We're talking about getting a certain level of control. I know you don't like the word over the situation.
So that's a problem, Andrew. So control.
Mr. Gillard, allow me to finish, Dr. Gillard. Allow me to finish.
Okay, go ahead.
I'm saying to you that there's a certain trend. You see this because you say you cannot know, you cannot predict it, but you see the actions moving in a particular direction. You see it already. You know the number of parents who said, I should have done this, I should have done that, I already saw this thing happening. So this is really revolutionary what you're saying there, Dr. Gillard.
So you see, that's very important what you just said there. So I should have and I should have. So before we get to I should have and I should have, then we have to allow the children to find us or see us as a safe space. So if I am a safe space for my child, the child will not need to be going to gangs and so on. The child will know well enough that if somebody approaches me for firearm or drugs or whatever, that I can say no, and that no is a complete sentence. I don't have to explain myself to anybody. I don't have to try and fit in with any gang, because I have this safe space at home. And separate and apart from that, this will not happen. So if I continue to try to control the child does not feel safe, and the child will find somewhere else that is a safe space for him or her.
I think Dr. Gillard does not like the word control.
Yes,
because
I really don't like it.
It is almost like controlling against the child's wishes. So I don't think he likes the word control.
And from my experience as a psychiatrist, that never ends well.
But Dr. Gillard, Dr. Surage, I don't know if you agree. The children only know to do wrong things when they're small. That's what they know to do.
The children are curious, like all curious.
I like Dr. Surage. So they're curious, and they want to find their way
and they don't
around
know
the world as they see it. So if I have a safe space of a parent, then I can explore my curiosity as I see fit, and I know that if something happens, I have this safe space to turn to. That person will come rescue me, comfort me, and so on. Oh. Yes, so that's the job of a parent.
So you have the 2-year-old child who's walking and toddler running around. You'll sit there, and he or she will venture. Say if you're sitting in a waiting room, she'll venture and come back. Venture a little further and come back. Every time one corner of the child's eye is looking at where the parents are. But they will, now if you are a very controlling parent, you say, no, don't go there. Yes. You begin to put limits and you begin this curiosity.
So the child is standing over a precipice or something.
Well, so no, Andre, that's different. That's different. So you see, so what
you
will
always say no.
What that kind of parenting he mentioned there about no does is that creates what we call anxious attachment. So the child then becomes fearful that everything everywhere I go towards, they tell me no. So I need to be careful, and I need to be cautious, and I need to question every decision that I make. Instead of continuing to be curious about the world around me. Yes, no matter how hard we try, the children will at some point get hurt. Could be that they go through a relationship and they get hurt. Could be that they go through an exam and they fail and they get hurt. The children will get hurt. So us spending our lives trying to prevent hurt does not benefit the child. It only creates a rift in the relationship, because the child does not feel safe with us.
And also make the child feel, the child gets more stressful when they are exposed. Say, they would leave, they would have done CXC, they would have done Cape A-level, and they're off to university on their own. What they're going to rely on at this point is what you have taught them, the manners, the etiquette, the values, etc. If you have overprotected them and did not allow them to experiment, allow them a certain latitude for them to feel comfortable and confident about, they will be lost, and they will be having difficulty making decisions and doing things, and so you see a different set of personality come out.
Yeah, and then when they come back, you're not happy with what you're seeing because you're saying, I raised you a certain way and I did everything for you. That's exactly it. I did everything for you and I made sure this and I made sure that. In other words, I gave you no chance to develop your own personality.
Right.
You left with my personality. That's what I gave you. And now I expect you to come back with that same personality when it's a whole wide world out there.
We'll have to take a break and we'll come back in just a moment to continue this very interesting discussion. This is Doctor in the House live on Rev-Up Slu, brought to you the compliments of La Place Saint-Lazare, the Library Cooperative Credit Union, also Tapio Hospital and Ultramart.
Tapio Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the radiology unit at 459-2201. Tapio Hospital, where the patient's safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Place Saint-Lazare is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Saint-Lazare, of course. La Place Saint-Lazare, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
This is Doctor in the House live on Rev-Up St. Lucia. Welcome back, Dr. Surage.
Thank you very much, Andre. And we've been having a very hearty discussion here, and it's quite interesting. I have with me in the studio Dr. Julius Gillard, who is a psychiatrist, and he's been there 2 weeks ago. We were discussing early childhood development, and now we are looking at what has happened down the line when they become adults, and how that upbringing has impacted, and other issues that they may have that causes anxiety, that causes stress, etc. Now, if you want to contribute to this particular conversation, or if you want to add or subtract anything from it, I invite you to call on the landline at 572-9710, or shoot a WhatsApp at 287-0971. While we are on a short break.
So you have a call, by the way.
Oh.
Mm-hmm. You'll have to use the headphones. Yes. All right.
Hello.
Good evening, Doc. Good evening,
Good evening, sir.
Good evening, sir.
Good evening, Dr. Gillard.
Hi, good evening.
Okay. Thanks
Talk to me,
for
talk to
accepting
me.
my call.
You're welcome.
All right.
Dr. Gillard, when it comes to stress, mental problem, mental challenges, mental illness, the impact is really on the brain, eh?
Yes, mainly, but not completely.
Okay. So is it that the brain, when it comes to mental illness, is it that the brain becomes overloaded?
Not necessarily.
Or the brain absorb something that we as a human being have no control over?
Okay, so that is a question. If I have to go down into that, it may take us a lot of time. But basically, when we are confronted with a stressful situation, like I said earlier on, depending on the beliefs that we have, the way that we see that situation, what that does is that you have a lot of things happening in the body and the brain, because you have hormones being secreted, the body and brain being prepared for fight or flight, because we go into survival mode, and because we're trying to figure out how do I either fight away that threat or that perceived threat, or how do I run away from it so I can feel safe again. And because of all of the neurochemical things that happen in the body and brain, we start to have certain sensations in our body, and then we start to have thoughts about the situation. And we as human beings tend to focus a lot on what we think and not what we feel. A lot of the times, and what I tell most of my patients is that our brain usually tries to distract us from what we're feeling in our body. Because when we feel stressed or something happens, we feel something in our body first, and then we start to create stories. This is bad, this is going to happen, if I need to control this, I need to do this, I need to do that. And all of that happens in the head. And if somebody is used to following those stories, they get caught up with those stories, and they start to do something called rumination. So rumination is basically what we call overthinking. So they start
but Doc, remember, most of how we feel and our action, it has a lot to do with our brain.
Yes, so the brain is where the thinking goes on.
Yeah, because you give an example there about the bed there. The person who walks away and the person, let's say, commit a crime there. I believe the person I don't believe the person really want to commit that crime there where he knows he'll go to prison or whatever. I believe something in the brain, and I don't know if you have any study about that. It's something in the brain that takes over the human body that causes this man, if he commit a crime there.
So I'm glad that you said something in the brain takes over the human body, and that's exactly what I'm saying. So we feel something in our body, and our brain usually distracts us or takes us away from that by creating stories with some person.
But how can you prevent that? What can you do to stop that from taking over?
By cultivating practices where you connect more frequently with your bodies. A lot of persons believe only when I'm stressed I can take 2 or 3 deep breaths. And that's not it. It's about learning how to breathe properly, because a lot of persons breathe using their chest and the intercostal muscles and so on, but naturally we're supposed to breathe using our diaphragm. And I'm sure Dr. Surage will tell you, the more you breathe using your diaphragm.
Before I go, Doc, this is something we have to practice every day. That is something.
Yes, every day, right?
This is almost impossible.
It's not, It's not.
Okay, I'll allow somebody else to make a contribution.
Thanks for calling.
Thanks for calling.
Okay, thanks.
Right. Okay, now while we are waiting for the next call, I think earlier on during the break you had some dying questions to pose.
I certainly do. I certainly do. First off, Dr. Gilad, is mental illness hereditary?
Not all mental illnesses. There is what we call a hereditary component, but I won't say it's hereditary. The hereditary is one of the risk factors for mental illness. There are lots of other risk factors. So like I said, I think the last time I was here, we have to look at the biopsychosocial aspect of mental illness. So the biological component, part of it is hereditary. And that's just one component of one of the components. Then we have to look at the psychological component, so the beliefs and so on that the person is carrying around. And then we have to look at the social component, so the environment that the person thrives or was raised in and lives in currently, and so on. So the friends, the work, and family, that kind of environment. So the hereditary part of it is only one small component that, yes, does carry weight in some illnesses like bipolar disorder. And because the hereditary component in bipolar disorder is pretty high, you can have up to 20 to 25% hereditary risk from bipolar disorder.
Can you tell me a little bit about bipolar? Because it's something that you've mentioned a few times. And
yes. So actually the DSM-5, which is the book that I follow, I think the ICD as well, the WHO as well does have similar diagnostic criteria right now. But it's basically they're what we call bipolar spectrum disorders now. So we don't just say bipolar disorder anymore. So there are 3 main disorders in the bipolar spectrum disorder. There is bipolar 1 disorder, bipolar 2 disorder, and what's a third one called cyclothymia. So with the bipolar 1 disorder, the person has a history of a manic episode in their history. So persons, when they start to get excited, say, I'm manic, and that's not what it is. So a manic episode, you look for 4 of I think 7 or 8 symptoms.
So they fluctuate between the very active and docile.
Yes. So basically, the brain speeds up, that's a manic episode, and slows down for the depressive episode.
So it's an activity.
Yes, of the brain.
Okay. All right.
So with the manic episode, they become they feel on top of the world basically.
They feel super nice.
Right. They feel supernatural, and then they feel very grandiose, and they become very talkative. They have a decreased need for sleep because they have so many goal-directed ideas that they're having. I have to do this, I have to do that, I have to do this. So somebody might tell you they rearrange the house 3 or 4 times, and they give away all their money to charity, and or they buy whatever, they make some frivolous investments. Those persons as well may become hypersexual, or they may become very flirty and so on when they were not before. Those persons.
And the same person will turn back and get more docile and more quiet.
So the person on another time, so it doesn't happen right away because a manic episode lasts for at least a week, and the person can become psychotic or may need hospitalization to get treated. On the other spectrum of it, there's a depression, and the person goes into some level of depression at some point of the illness, where they feel sad mood, they lose interest in things they used to be interested in before. The sleep issues that I mentioned earlier on, but with depression, the person falls asleep but wakes up early in the morning and can't fall back asleep. Then the person may also have difficulty making decisions, have loss of appetite. In some cases, the person's appetite increases. And even with the sleep, in some cases, the person sleeps a lot. So they may have what we call hypersomnia. The person as well may beat up themselves a lot. So they be very self-loathing. So we call that excessive guilt. And as well, some persons can have thoughts of death or dying. People think it's just suicidal thoughts, but it's thoughts of death. So I would be better off if I'm not here, or
that's when they're on the low.
When they're on the low. Yes. So what we've learned through research is that the depressed brain in a bipolar person does not like to feel depressed. So a lot of persons, when they're very depressed, we tend to look for a rebounding manic episode, because the person's brain decides, I don't like to feel that way, and it starts to speed up, and then the person then can become manic, and those persons, when that happens, we say they have rapid cycling bipolar disorder, and that is a bit more difficult to treat than normal bipolar disorder.
But these people, they know who they are, they know where they are, they're not mad.
Well, people, I don't use that kind of language, Dr. Surage. I don't use that kind of language
at all.
They're
in touch with society.
Yes, until they become psychotic. So a manic episode, if it becomes severe enough, can lead to psychosis. They can lose touch with reality. That's how we say it. Not mad, but they lose touch with reality.
Well, that was a loose word.
Yes, I know. It's a popular parlance.
So let's just segue into my next question, Dr. Gillard. You know, we're a Christian society, okay? And we've been brought up on the Bible, especially certain stories in the New Testament where Jesus Christ is concerned. Now, I think you know where I'm going with that already. Jesus Christ, according to the books of Matthew, Mark, Luke, and John, often came into contact with what was considered at that time to be demonic possession. In a few instances, and one in particular, the individual was so strong that they literally had to chain him, okay, to keep a certain amount of control. And in all these instances, Jesus Christ spoke to the demon, supposedly in this person, and the demon left the person. So the Bible says, and the person became normal. Okay, again. So what I want to ask you is, based on that, is demonic possession something that is real? Does that exist? And if it does not exist, how do we decipher? No, sorry. If it exists, how do you decipher as a professional the difference between demonic possession and somebody who is having a mental breakdown or episode?
So one of the way I want to respond to that is that's beyond the realm of my expertise. And I'll tell you why. We have to look at something called stigma. So stigma is one of the things that actually causes mental illnesses to have a poorer prognosis or a poorer course. Because somebody believing that I have or my child is demon possessed, or my husband or my wife is demon possessed, what they do is that they prevent that person from getting early intervention. The earlier intervention that the persons with severe mental illness receive, the better the course of the illness. The longer they keep the person from treatment, the poorer the course. And a lot of the persons you see walking around the streets and or at the wellness center and so on, those persons very likely got into treatment pretty late. And I think research shows that if as long as you spend more than 2 years in persons with schizophrenia, more than 2 years untreated from the onset of the illness, the course is a lot poorer than if you got into treatment earlier. So I don't know much about demon possession and so on. Somebody comes to me with a relative, or they come to me with something and they want to explore that. I'm very open to it, and I let them know, yes, anything that would make your relative or make you better, I am open to it. However, this is my expertise. My realm of expertise is this treatment, and I recommend that. So maybe you can, because I don't force things on people. I like persons to feel, your word, in control of their illness. And so I recommend the treatment. They have a choice as to whether they want to take it or not. I don't coerce anybody to take any medications, because I know that psychiatric medications have their side effects and so on. I encourage persons, yes, you want to see a healer and so on, that's fine. And if you're feeling better by the time you come see me, we will see the differences and so on, and so we can have conversations around that. But as to whether it's that cause as a demon possession in comparison to a primary psychiatric condition, I cannot say, because it's beyond my realm of expertise.
Let me just give the numbers again, and we do have a call. The fixed line is 572-9710, 572-9710, or you can WhatsApp 287-0971. WhatsApp is 287-0971. So we have somebody on the line.
Hello.
Yeah.
Good
Hello,
evening.
Doc. Thank you again. Thank you for taking my call.
All right.
My call.
Okay.
Thank you. Dr. Gillan, what really happened when some mental illness, I'm stressing that mental illness, when somebody reaches a stage in mental illness of no turning back? No matter what you do, what really happened?
Well,
there.
Like I said earlier, you have to look at risk factors. So we don't just say somebody reach a stage of no turning back. We have to.
But Dr. Gillan, there are people who you can see them in tongue. You can see them in tongue, and you can see at least there is no return.
What do you mean?
To these people.
We assume there is no return for these people because we don't have the mental health support systems in St. Lucia to deal with them. But somebody like that treated in another country, they do pretty well. They get assisted housing. They get a place where they can plant their little garden. They get a little subsistence every now and then, so they could buy their cigarettes or their groceries or whatever it is they want to, and they can live independently with the correct support system. We don't have that here.
So Doc, you mean all mental illness have a treatment?
As far as I know.
And a cure?
I won't say a cure. The one, for example, schizophrenia, because a lot of the persons we see walking around town have schizophrenia. Those persons, 1/3 of them, you could say they're healed. They are cured. Another 1/3, the symptoms are managed with medication. And another 1/3 are the ones who have what we call a poor prognosis. And those we have to look at the risk factors, how early they were treated, whether they have a support system. And even those 1/3 that have a poor prognosis, with adequate support, they tend to do a lot better than if they don't have the support.
But there's also
so Doc, let me finish my last question. Doc, with you as a what's your profession?
Psychiatrist.
Oh, a psychiatrist?
Yes.
Is the same as somebody who
a doctor who treats mental health.
Who deals with the brain?
Yeah.
Oh, okay. Okay, thank you.
All right, okay, you're most welcome. Right, and I think what I was going to tell you is that there are many people you see on the streets. They may be taking other medication, other drugs, other things that compound their problem.
Exactly, so the risk factors.
And some of them, from what I heard about, there was a time when house was set up where they could have gone in there, sleep and been taken care of, etc. And they never stayed there. They went back on the streets because I think they just love to be able to be out.
It's not that they just love, because we have to look at the symptoms of the illness. A lot of those illnesses come with what we call comorbid disorders. So substance abuse is one of the more comorbid in persons who have little support. So because these substances are very addictive and it sends dopamine to the brain, especially in somebody who has low motivation and so on. Get a dopamine hit and my motivation increases and I feel good about myself, because otherwise I feel horrible and I have medication taken that makes me feel even more horrible. So the substances do have a place in those persons' lives, and persons tend to punish them and look down on them for that. But it's the person trying to survive.
I will not call.
Hello.
Hello,
good evening. Yes.
Great program as usual.
Thank you.
I would like to ask a question, please.
Go ahead, let's hear you.
Is it a form of anxiety if you constantly think about how other people would feel if you do something, or is it just your conscience?
No, it is a form of anxiety because that's what we call excessive worry. So you're having excessive worry and you have difficulty controlling that worry. It would be good to have a conversation with a mental health practitioner. So because there's that worry and there's something called obsession. So obsessions would be a symptom of OCD. Some persons have what we call intrusive thoughts. So I'm sitting here and a thought coming to my head, just grab that glasses of Andre's eyes. And that is an intrusive thought, and I feel anxious if I don't do something about it. I feel like I need to grab the glasses of Andre's eyes. So it would be better to have a conversation with a mental health practitioner to find out whether you're having worry versus intrusive thoughts.
Okay. And is it, can I ask another question, please?
Sure, go ahead.
Is it, is worrying the reason why we think that parenting is difficult? I'll listen over the air. Thank you.
Okay, no problem.
You're welcome.
Yes, I suppose because worrying is basically a symptom very closely linked to apprehensive expectation. We worry that our children are going to turn out horribly, and we have no evidence of that with our children. And what we do is, so we look outward. So that mother did that to that child, or that to that child. And we're not seeing that exactly what we're doing to our child, that's what that mother did to their child. So we're trying to prevent the same outcome using the same method that had the poor outcome.
Could that be an example whereby a young lady gets pregnant early, has a child. Now she's grown bigger, the child is getting to the age of say 13, 14, 15, 16. And because of her experience, she is being very strict and controlling over the child.
It's not just that, Dr. Surage, and I had a similar example recently. A daughter of a lady who got pregnant when she was 13, And the conversation we had was, put yourself in your mother's shoes. You're 13 and you're pregnant. What is that like? She told me I would be terrified. I said, exactly. And you're in secondary school and you're doing well and you're pregnant. She said I would feel like I've destroyed my life, and I would feel angry at the world, and all other stuff started coming out. And then she started to see where her mother's behavior was coming from. Understand? And it's not easy, and that's what I mean when I say about providing support to pregnant women and girls, if it's a girl.
Yeah.
How do we support those persons when they get pregnant to ensure that the child has a better chance at life than they're having now if we don't provide them support?
You have a call.
Hello, good evening.
Good evening.
Yes.
Then Dr. Gillard, then Dr. Surage, good evening.
Good evening.
Right.
Bonsoir tout le monde.
Bonsoir.
Should I add my 2 cents to the subject?
Yeah, sure.
Quickly?
Yeah, let's hear you.
I would say, in English, you would say stress is too much of the negative thinking on the brain. And it has a lot of signs where you see heavy eyes, you have bags under your eyes, you can't sleep. You self sometimes could trigger stress to your life without you have an issue. For instance, time of COVID, you don't know where, you don't have nowhere to go, you're not working. Every essential workers only that's supposed to be out there, and you just in the house. You're thinking, you don't even know what day it is and everything. So all that build anxiety and put stress on the brain. Parfois, you can dire que ça top vieux kachil, allez li do ka mettre en matière, allez cervelle là. Et puis quand pécho fonctionne, man aussi posé fonctionner. Ou même ça fait un problème en kachilou, depuis pas positif, ça même ça détruit ça, ou même ça crase quoi. C'est pas obligé ça monde là, ou même. Vous comprenez ça là, Dr. Surage?
Yes, yes.
Ou même ou ça crase quoi comme ça, puisque ou supposé connaître primaire et ou même pas qu'à faire bagay là aussi supposé faire pour ça éliminer ces bagay sans les lido. Aller ça là ou même de les ou dans crain et ou pas vle acheter pour ça yo qui pour mon hedo et ou là ka souci de tout là ka de smode zong et ou même pas vle aller dans lâcher puisque ou pas vle moun dit regardez un homme qui fait ça, une femme qui fait ça, vous comprenez? So aller ça là nous même ça fait c'est bail sans problème puisque l'idée c'est vers là où qu'il a c'est très important sous pas bail bon manger, sous pas bail bon assistance, il pas qu'il fonctionne bien.
Oui.
Aller ça la montée pour dire anti créole bail puisque nous tout ça mon carton nos frères là c'est
anglais.
Oui.
Mais ça me voit ce créole là tout.
Mon cuit tout, n'a mangé cuit tout.
N'a mangé cuit tout.
N'a mangé cuit.
But there is a book, a small book called As a Man Thinketh by I forgot the name of the author, and he talks about it's very pleasant reading. He talks about what occupies your mind, what you're spending your time thinking of. These are the decisions you'll make, and this is where your life will go.
Ou ça pour qui ça m'a dit ça donc encore vêtements puisque c'est grand monde qui ja vivent combien l'année avant nous. Là on m'a dit yo ça au de l'anglais, là on interview yo, là on m'a dit yo questionner yo qui ça yo t'a faire, les était plus jeune qui ça, yo habité quoi yo et puis c'est yo quoi do glossus dashin ça yo do chai budget. Vous comprenez? C'est pas rien comme c'est un supermarché là et bien marché yo aller acheter bagaille. C'est même bagaille là nous là, c'est ça yo manger. Et puis ça mon ka ouais achat moun ka fait aussi c'est bagay là qui bon pour nous ka quitter derrière et puis nous ka aller marché côté nous qui supermarché et nous ka mener la cage nous puisque c'est bail ça ben sel ben sick qui pas bon pour nous puisque les bon lever côté boy ça din salé volant c'est sel la mer ou ka salé aller ça là il pas ka détruire nous c'est viande non ka mettre il ka venir comme couleur ou ka prendre ka la glo choix suit ou ka prendre ka couper ka aussi et puis goloyon ka ba chou manger pièce on pas ka mort tout monde là hein à chom là ça ou quoi puisque à chom là tout bagay c'est quand mané ou ka di ça tout monde veut we produit vêtements tout bagay so aller ça là tout monde c'est quand ka di ça l'anglais tout monde tout bagay so demande aller ça là tout monde yo ka recycle tout monde là so aller ça là tout ces bagay ça qui pas bon pour nous ça nous ne pour faire pour anti longette pour anti goditi anti bagay point vous comprendre boy il bon vous comprenez sous manger là ti maman ni chanke be bagay ce qui sont rabay ti lok ti bay a chom là ou ka acheter toute vieille bêtise ou pas bouser so aller ça là nous pour prendre jig et puis nous pour savoir qui ça nous ka mandi dans nous comment toujours dou et moi quitter ça tout au soir là tout le monde qui attend nous c'est manger si poser médication si pas ça médication que tourner manger merci.
Ok, merci, thank you very much. Merci pour contribution ça au fait là. All right. So,
I know the topic has been mostly stress tonight, and for whoever's listening, what I want you to know is stress causes secretion of cortisol. That's the main hormone that's secreted when we feel stressed.
By the body.
By the body.
Yeah.
And I want everybody to look at the effects of cortisol on the body, and it'll blow your mind. And there's been a lot of research around that. Most even medical illnesses that we encounter now are due to stress, and stress may even appear as suppressed emotions. So we push down emotions, and that is we have to go through some manner of stress to push down. So I'm angry and I smile. I push down the anger, and that secretes cortisol, and I smile, but my body is experiencing the effects of the cortisol. And so it's not about lashing out in anger and so on, but knowing how to express emotions appropriately. And we don't teach that in schools. We don't teach that at home, in most homes. And so persons go around with stuff that is pressed down, that they don't know how to deal with. And
pent-up
it appears as multiple mental disorders. It appears as crime. It appears as substance use disorders. Most of the guys under the market, you go around asking them about their stress levels, and you'll be amazed.
No, yeah,
they don't. They may be more stressed than all of us inside of it, because they'll tell you stories from their childhood that you may wonder what kind of parents these people have, kind of wicked parents these people have, or they may tell you stuff about other aspects of their lives.
You mentioned about the market, but I suppose if you were to interview those either at Bordelais or at
I do interview them at Bordelais, and I can tell you the kind of stories I get. It's amazing that they only at Bordelais and not in the graveyard.
So why is that we as a nation has not begun to address the early upbringing? Because to me it is critical that this is part of where to attack.
Because we only see in the effect, and we're not focusing on the cause. We're only focusing on the effect. So the effect is that there's crime, and let's focus on crime prevention and crime mitigation and all those things, and we're not focusing on the cause.
Right. It's almost like a fire is burning.
It'll continue to burn.
It will continue to burn,
yes.
But if you do not begin to change to deal with the source. And so as far as I'm concerned, it's almost like a no-brainer to tell me that when society has so many issues with it in terms of violence, in terms of crime, in terms of even those that are not crime but poor upbringing and abuse of children, abuse of women, and abuse of people who are underprivileged, etc. And we know that the genesis of all that to a large extent starts with the early childhood development and upbringing, and we do nothing about it.
Yeah, and I mean, if you have to look at the investment that we make into mental health, I think the WHO AIMS report that I mentioned earlier, 1% or maybe 1 to 2% of the health budget, not even the total budget, of the health budget goes to mental health. I don't know if that has changed, but at that time in 2010, that's what it was. And if that's how we treating the mental health of our populace, I don't see that we would be doing well. we have to look at the examples of the Scandinavian countries. These countries make a modest investment into mental health, about 5% of the total budget or 2% or something like that. But it's a modest investment, and the mental health of their populace is a lot greater. Those countries used to have high suicide rates before, and those rates have gone down significantly. The depression, suicide, anxiety, all of those things have decreased.
Incarceration as well.
Incarceration, they now turn in prisons into other, repurposing them for other things. Crime rates are significantly lower than other parts of the world, and that is because they're investing in mental health.
And we know what the Dr. Gillard said earlier was really, really important. Those people that we call the jumbies, we see them walking all over the streets and so on. He's saying that if we would invest in the
support systems
for them, that they can live normal, quote unquote normal lives, right?
Yeah.
Wow.
That's right.
How do you end up interacting with the inmates at Body Day? Because I hear you mention that sometimes.
Oh, it's part of my work. That's all I can say.
Because I know you said in the last program that Body Day does not have a psychologist or
a counselor.
A counselor, yes. So I'm just curious.
Yeah, it's part of my work.
So is this sort of part-time arrangement where you just
I can't really go further into that. It's just part of my work. Let's just leave it there.
But certainly it's not sufficient, obviously. When I say sufficient, meaning in terms of, again, the investment.
I don't do therapeutic interventions there. I more do consulting, you could call it.
Oh, okay.
Yeah. Okay. Well, there you are, folks. And I'm sure we had a very interesting chat here. And I think Dr. Gillard began to summarize the activities very nicely. So the only thing we didn't touch on was suicide.
That's for another show.
I think so.
But listeners, I hope that you enjoyed it and learned something from it. As you can see, we are unraveling the areas where we think that the society can be much better served if attention is paid at that early childhood level, and to begin to create a more harmonious interaction between people and society at large. Thank you very much. So next week we'll be here again. And Dr. Gillard, thank you very much.
Thanks for having me.
Any particular word you'd like to say for the parting words to the general public?
Yes. You don't have to run, because a lot of persons, when they feel stressed, they try to run from it by engaging in activities that just make things worse. So it's about, what am I feeling? Even though I'm feeling anxious about something that's happening, what am I feeling? It's my feeling, and how do I connect with myself more? A mental illness does not mean the end of the world. So there is treatment for majority of mental illnesses, whether it be medication or therapy or other interventions. So mental illness is not the end of the world, and we need to learn how to manage our mental health better, and it needs to start from before a baby is even born. So how do we support each other in that role? That's what we need to start looking at as a society.
Thank you very much, and thanks for your sterling contribution over the past 2 sessions, etc.
You're welcome.
Thanks again. I hope.
Thanks for having me.
Okay, good.
And thank you, Dr. Julius Gillard. And thank you, Dr. Surage, for your service.
Thank you.
Thank you very much. Okay, you've been listening to and viewing Doctor in the House on Rev-Up Slu every Tuesday from 6 p.m. to 7 p.m. So listen again next week, Tuesday, same time, for another Doctor in the House. Brought to you with the compliments of La Place Salaison, Ultramart, the Library Cooperative Credit Union, and Tapia Hospital.
At Tapia Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapia Hospital, where the patient safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time, a time when your plans and dreams fall into place, when what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune in to us at 97.1 FM and online at revupslu.com. Call the studio at 572-9710 or WhatsApp 287-0971. Our Rev-Up office numbers are 572-0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.